Hello students, welcome to JXE 141, Theme 3, which is Risk Factors and Common Injuries Among Athletes. My name is Ashley De Beer and I will be facilitating this section. A little bit about myself before we start. I'm currently a sports scientist at Semley. I predominantly work with the men's and women's Tuks hockey team, as well as the Southall Women's Youth Academy. For the current section, we will be covering a range of topics related to injury and some of the more common risk factors which may heighten the chance of injury. Here, you will gain an understanding of the holistic, multifactorial risks associated with injury, as well as the unique injury risks present in various sporting codes. Why these risks are present will be covered, along with the practical strategies which a sports scientist may use to mitigate the chances of injury. The appropriate learning resources have been added, and it is strongly recommended that each of you take the time to read and understand the different topics presented. Further reading around the different muscles, ligaments, and bones will give a deeper knowledge of some of the sites of injury, although this is not compulsory. Considering the amount of bones, muscles, tendons, and ligaments in the body, the possibility of injury is quite high and can often be complicated. However, research has identified a number of recurring injuries which occur in certain sports. The key sites of interest in this theme are the ankle, calf, knee, muscles of the thigh, injuries to the hip and spine, the shoulder, wrist, and head injuries, namely concussions. Each injury will vary in severity and can potentially keep an athlete out from anywhere from 1 week to 9 months. The specific site of injury, how the injury occurred, and the potential reasons why the injury happened are all of great concern to a sports scientist. Although we do not deal with the treatment and initial phases of injury rehabilitation, having a basic knowledge of some of the facts will allow us to better program and condition our athletes, thereby reducing their risk of injury. The unique demands of each sport produce certain movement patterns, and it's these movement patterns which create the risk. An example of this is the high amount of hamstring injuries in football players due to the stress placed on the legs from sprinting, accelerating, and deaccelerating. Therefore, as a sports scientist, I would ensure I focused on hamstring strength to prevent the injury from occurring and to ensure that the player is able to participate on the field. Different examples are given throughout the presentation, but this is by no means an exhaustive list. There are common risk factors, such as age or past injury history, which will increase the risk of injury regardless of sport. These are general concerns which must be noted on an individual by individual basis. Some can be classified as modifiable, i.e. we can limit their risk, while others we will have limited control over. A selection of common risk factors is presented, along with how they impact upon athletes. Hopefully, you take away an appreciation for how complicated injury risk is, and it is the job of the sports scientist to try and limit the risk that an athlete is exposed to, with the understanding that this is not always possible. Certain injuries can be outside of control, but armed with the best practices and an individualized approach, we can play our part in reducing the risk which athletes face. I hope you enjoy this theme, and I wish you the best of luck for the rest of the course.